This video has been produced by Annie, Hon, Jess, Mahin and Robyn at the University of Bath, aiming to engage and educate patients and the wider public about the myositis research that's going on here at Bath. So, what is myositis? Myositis is a rare autoimmune condition, meaning that it is caused by a problem in your immune system whereby the body mistakenly attacks its own healthy tissues. It causes chronic progressive inflammation of the muscle and skin, but can also carry comorbidities such as cancer and lung diseases. It can affect people of all ages, and patients can be classified based on juvenile or adult onset. Myositis can be characterized by muscle pain and weakness and may require long-term treatment. There are a few different types of myositis, including polymyositis, dermatomyositis, and inclusion body myositis. The broad variety of symptoms that come with these subtypes makes diagnosis and specific classification difficult for clinicians. Polymyositis affects many different muscles in the body. These are predominantly near the chest and abdomen, including the shoulders and hips, and is more common in women aged 30 to 60. Dermatomyositis largely affects the skin and muscles, causing rashes and dry skin. Again, this is more common in women but can affect children. This can occur suddenly or develop over months. Finally, inclusion body myositis, or IBM, is characterized by symptoms such as weakness in the thigh muscles, forearms, and lower leg muscles. The weakness tends to begin in the smaller muscles such as the wrists and the fingers. It is most common in men over the age of 50. Myositis can be diagnosed in several different ways. These include biopsies, electromyography, MRI scans, and blood tests. Clinicians can take biopsies, which are muscle samples, to look for any swelling or damage of cells. Electromyography, or EMG, is used to evaluate the activity and condition of muscles in the body. EMGs gather information to allow clinicians to determine if muscle weakness or pain is being caused by nerve disease or muscle disease. MRI scans are used to generate digital images of the muscles, allowing observation of muscle inflammation. The three methods mentioned so far have varying levels of effectiveness, highlighting the need for more specific testing and diagnosis on a person-by-person basis. Raised levels of enzymes and antibodies can be detected in blood tests. Detection of antibodies provides a potential avenue to improve diagnosis in myositis. Firstly, what are antibodies? Antibodies are proteins produced by the immune system that recognize and bind a specific marker found on the surface of cells. These are usually foreign cells, like bacterial cells, and in doing so, they tag the foreign cell so that they are recognized and attacked by the immune system. Autoantibodies are antibodies that bind to your body's own cells instead of binding to foreign cells. In myositis, these antibodies may bind to your body's own muscle and skin cells. There are many different autoantibodies specific to myositis, and different types of autoantibodies can be linked with different myositis subtypes or clinical features. Autoantibodies can be found when symptoms begin to develop, and 60% of myositis patients have a myositis autoantibody detectable in their blood. The specific nature of how autoantibodies bind to target cells, combined with their unique relationship to different myositis subtypes, makes them great potential indicators in myositis. They can provide vital information that could help clinicians with earlier and more accurate diagnoses, which in turn allows for more precise prediction of prognosis and therefore aid the planning of a more personalised and effective treatment regime. Dr Sarah Tansley is a clinical lecturer at the University of Bath who is researching the role of autoantibodies in myositis. As Dr Tansley works both in the clinic and the labs, she has insight into both research and patient-facing environments. We will now pass over to Sarah, who will talk about her work.
My name is Sarah Tansley and I'm a researcher at the University of Bath and also a rheumatologist. My research focuses on autoantibodies, which are markers detectable in the blood of patients with different rheumatic diseases, including myositis. Myositis-specific autoantibodies are autoantibody markers that are only found in the blood of patients with myositis and aren't detectable in the blood of patients with other rheumatic diseases or healthy people. There are many different myositis-specific autoantibodies, and some of them have been discovered at the University of Bath. We know that every patient with myositis is different. Some patients go on to develop important complications like lung disease or cancer, and it's really important that we can identify those patients early so that we can monitor them closely and start treatment as soon as a complication develops. Predicting those patients who are at risk of these different complications is really challenging, and myositis-specific autoantibodies is one of the important tools we can use to do this. Different myositis-specific autoantibodies are associated with different disease clinical features and can help identify those patients who are at higher risk of important complications like cancer or lung involvement. As well as looking at how myositis-specific antibodies can be used to help make diagnoses and identify those patients at increased risk of important complications, my research also looks at different ways we can test for myositis-specific autoantibodies to ensure that the tests that we are doing in hospital are as reliable as possible.
We want to give a big thank you to Dr Tansley for sharing her wealth of knowledge and helping us put together this informative video. But most importantly, we want to thank you as the viewer for helping with our initial research questionnaire and for viewing this video. We were overwhelmed with the initial response and are so thankful for everyone's willingness to share their experiences. We would be really grateful if you could leave us some feedback about this video by following the link to a Google Forms in the video description. The feedback from our initial research and this video has been and will continue to be shared directly with Dr Tansley, who believes that this information will be extremely useful in progressing research. Finally, you can find out more about Sarah's work by visiting her ORCID page as well as her University of Bath research portal. Here you'll find other publications and works in progress. For general information, support and guidance on myositis, please visit Myositis UK or the Myositis Association. All links can be found in the description below.